So this week, a lot of improvements since Tuesday's operation. My anesthesia is all worn off. Body functions are back to normal. No drainage, no leakage in the site at all. I will be having the staples taken out next week. So right now everything is healing. I want to just talk a little bit about pain medication. I've just taken acetaminophen that you've been prescribed for me, and I've taken it maybe twice a day, once during the day and then once to sleep. Evenings are a little rough, still sleeping, but it's gotten a lot better. Range of motion, I'm still at 150 degrees, and it's stiff, but it's better. Just a little bit of pain when I make the movement, but not terrible. So there's no drainage. I've stopped using the covering. Today is the first day without any cover since it was not leaking anymore. Still covering it during the showering. So I'm going to demonstrate the PT exercise that you've told me to do. It's much easier now than it was last week when I was in the hospital. The first motion is usually a little stiff, but as I do 4 or 5 of these, it starts to get easier. And some pain near the bicep elbow area, just a little. I could feel that I could move my arm. Even though it's in a passive motion, I feel like I have a little more strength in my arm. Okay, so that's the end of week 1's progress. I will, again, continue to document my progress from week 2 through week 6. Hi, this is Tom DeNiro. This is end of week 2 after surgery. I just want to give you my progress report on how I'm doing. So the pain medication, I'm pretty much off it. This past week has been mainly using some medication just for the evening to sleep, and almost none during the day. During the beginning of the second week, I did have to have some rescue medication during the day to help me get through a little bit, but I've only been using the acetaminophen and not the oxycodone at all. So just, but now it's the end of the second week, and I'm almost off my meds completely. And my exercises are getting easier. My arm seems lighter, and that's probably because this is starting to heal. So they just put some strips on, and still need to keep it dry so it hardens a little bit more. So I am still covering it when I shower. It seems easier. I do seem to be having some issue with it wanting to pop out at the very end of the motion at about 160 degrees. So I've been working hard on my rotator cuff exercise to strengthen those tendons. As I bring it down here, I do get a little sensation like I want to baby it a little bit, but I do let it stretch. It's not popping out. I'm letting it stretch for 10 seconds. Then as I bring it up, I get a little pinch of pain as I lift, and I get a little bit of pain at 90 degrees, not much, just a very little. This is getting much easier by the end of the second week. I almost feel like I could do it without any assistance. So this is my end of the second week progress, and I feel like I'm doing pretty good. Feeling more and more normal. So I'm going to continue my exercises at least 5-6 times a day, and we will meet again next week. So the gains that I've made in this past week, I've have much less pain. When I do my PT exercises, I do have a little bit of pain just at the bottom, and then when I move my arm through the motion, just a little bit of slight pain at the 90-degree mark and then nothing. I've been cycling almost every day so my hands are out a little bit this way with a little bit of load on the shoulder. Not a lot, but a little bit. And that was starting to give me a little bit of irritation. So I backed off a little bit on that, so I'm not doing that anymore. I did feel a few little popping motions as I was stretching, so I still feel when I get to the end of my stretch, I still have to do it gingerly because I don't want it to pop. I have a couple steri strips still left on, only because it seems to be a little bit wider down here and it's not hurting anything, so I just left them on there. I am showering now, not covering it, just so it seems to be healing pretty well. Okay, so just a little tiny twinge of pain there, very slight. When I get here, I want to go very slowly because it feels like it wants to pop. So I just sort of relax it at the bottom here and I can feel the muscle stretch and it starts to drop a little lower, giving me a little bit more of range of motion. So I just leave that, let that hang there a little bit. And then on the way up, just a little slight twinge of pain as I come back up. But it's so much less than week 2. I found this week to be maybe a step backwards. I feel a lot more pain this week. I'm feeling a lot more clicking and popping as I do my exercises, and I'm getting like sharp pains around the site, around the scar site. So it feels a little bit discouraging that I'm feeling a lot more pain than I did at week 3. But I do have more range of motion. I do feel a little stronger. So this is quite painful right now. I have to kind of relax the arm as I go up. I almost letting go of the rope. I do notice that I have much more of a stretch using this mechanism than laying down and just raising it over my head. But because I'm letting most of the arm do the work, instead of having the therapist arm pull my arm up and down, it hurts a lot more, right in the deltoid muscle. If I just do it with my own arm, I can't raise it very far, only to about here. So that's all I have in terms of motion. That hurts quite a bit. But if I do it with some passive movement, I can get the arm up. I realize that this is now a slow process that I am going to have to just be patient and go slow with. This is week 7. I just wanted to give you an update of the previous weeks since we hadn't filmed it. So at week 5, I was still using the pulley to move my arm up and down vertically and also horizontally. Also at week 6, I was doing the same, but I was starting to introduce some other exercises, some strengthening exercises with lifting very minor weight or just using my arm laying on a flat bench and then incline and then sitting up with no weight. And then I began to introduce lighter weight as I started to add more exercises like the rowing machine and the lat pull machine and military presses with just the Smith bar, and also introducing 3 and 5 pound weights to my flat bench and incline bench. Okay, so in terms of pain and stiffness, I've definitely felt more pain and more stiffness beginning in week 5 and 6, and also in week 7 I'm starting to feel a little bit more stiffness. Part of it may be that my exercise regime may be a little bit too strenuous, so what I would do is I would relax a day or two and then go back to working out again. I took this simple shoulder test last week at 6 weeks, and I still have sleeping interruption. Although I can lift a 20-pound weight or hold a 20-pound weight, I can't wash on the back of this arm yet comfortably. I do feel like a lot of pulling and popping, so I don't do that. I don't want to toss a ball yet, underhand or overhand. I can tuck my shirt in the back, but it's difficult, so I would consider that a no. But everything else on the simple shoulder test I can do. End of week 8, and I just want to show you my final progress before I have my evaluation with you this coming week. So I'm going to show you some of the exercises that I can do and some of my flexibility. Okay, thanks.
Change them, rearrange them in your mind. If you love tales of transformation, well then 1, 2, 3.
So throughout the 8 weeks, I try to keep up my my stretch and keep the range of motion, which I think I have. A few weeks were probably the toughest. Were probably week 3, week 4 were tough. Week 5 was hard, but then I really kind of turned the corner at week 7 and week 8. I really feel pretty good right now. I have lots of flexibility. Still can't raise the arm over my head very well, although I'm working on that as I continue to strengthen all the muscles around it. So, and now I'm in formal PT, so that should help as well. So thanks, and we will send this to you next week. Take care. Bye.